Hi, my name is Dr. Daniel Roney. I'm a board-certified chiropractic physician, but I'm also a specialist in something called functional medicine. And we'll talk about that in just a minute. The idea or the objective of this video is to teach you, first and foremost, I want to teach you how to heal, okay? And what I mean by that is there are different healthcare paradigms, right? There's the conventional allopathic model, there's this alternative healthcare model, etc. And I want to, beyond our relationship possibly as a doctor-patient, I want to teach you what I've learned, right, over my studies and my career about healthcare. And personally, as a healthcare consumer, what I've learned, I first and foremost do it for myself and my family, and then I also do it because I'm a healthcare provider and I want the best for my patients, okay? So there's been excessive amount of studying and learning and navigating through this healthcare world to be able to teach you what I now know. This is important because the concept of teaching you how to fish as opposed to giving you a fish is really the idea. And unfortunately, in today's both alternative and conventional world, the model is more to give you a fish as opposed to teach you how to fish. And to a degree, that's why you've been suffering. Point that I'll make, there's a lot of band-aids given without enough correction of mechanisms or causes as to why a symptom or a problem exists. And that's what I want to get into. Again, you know, from a functional medicine standpoint, a functional medicine, just briefly, is the ability to understand when a symptom arises, and we'll use high blood pressure as a quick example. When that blood pressure goes up, the standard care for that is to go to your conventional doctor, allopathic medicine, and the doctor will give you a blood pressure medication to bring the blood pressure down, okay? Now, that is going to get you out of danger, meaning you're going to lower your risk for heart attack or stroke or what have you, right? By bringing that blood pressure down. But it has never addressed or even looked at the causes. What happened to your biochemistry? What happened to the function of your body that caused your blood pressure to go up in the first place? And that is one of the main points that I want to make, is there's never a look at, and I mean never a look at what caused that to happen, right? So in that model, the blood pressure, if the causes are still there, the blood pressure may continue to go up, more medication might be needed, or different medication, or a second or third medication, etc., in order to combat that blood pressure. But nothing was ever changed. You didn't get healthier from that, you just were out of danger. So there's a point of being out of danger, which I agree with, we need to be out of danger, but if that's the only plan, that's a really bad plan. Okay, because we now know with studying and physiology and studying biochemistry that there are mechanisms that have caused that if we address, we can change the blood pressure, and meaning we can heal it and cure it as opposed to just band-aid. Okay, alternative healthcare is very similar, especially as it relates to chronic pain and chronic fatigue. And what I mean by that is you go to the alternative healthcare provider, and they say, well, you have this symptom, this symptom, this symptom, this symptom. We're going to give you this herb botanical, this herb botanical, that herb botanical, and I want you to take those. And maybe you feel a little bit better, but it's the same mentality. That really hasn't changed the mechanisms or addressed the causes. It just maybe altered some physiology, so maybe you feel a little better, but it didn't clean anything up. And so, you know, again, the point being is that there's a pill book in medicine and an herb and botanical book in natural medicine. And they're both written the same way. They're written with this mentality of, if you have this condition, take this medication. You have high cholesterol, take this statin med. If you have this symptom, take this herb or botanical. Same thing, if you have high cholesterol, maybe take this or this or this in the herb and botanical world, right? Or supplement world. Well, either of those approaches are the same. It's just a band-aid. So we get patients that come in either on a lot of medications or a lot of supplements, and they're not feeling any better. Maybe they're feeling a little bit better, but they're still sick. And that's because either of those approaches did not address the mechanisms or the causes. And that's so important to understand. So in functional medicine, I've gone back to school hundreds and hundreds and hundreds of hours to study that when a symptom arises, especially in this chronic pain, chronic fatigue world, when these symptoms arise or these problems occur, what mechanisms have changed or what physiology has changed to cause the mechanisms. Then we can apply science-based nutrition in order to alter these mechanisms here so the problem can no longer exist. And that's the idea that I want to introduce you to that's going to allow you how to heal. Because for most of you, that concept has not been applied or it hasn't been applied properly. Okay? So that's what I want to open the door to. So as if we work together, I need you to understand the difference as to what I'm doing versus what most other healthcare paradigms are doing, alternative or conventional. Okay? So let me state this. The statistics on chronic conditions, chronic pain, chronic fatigue, autoimmune conditions, thyroid malfunction, etc., is growing at almost epidemic levels in the United States. We lead the world. We're number one as far as chronic conditions. People that suffer from one or more chronic problem day in and day out. We lead the world, okay? One point that I'll make with that, there's reasons for this, okay? There are absolute 100% studied, researched reasons why this occurs. So the first thing we need to do is be acutely aware of what the research shows. And that's what I'll go into a little bit today to help you out, okay? And then once we understand that, then we need to apply, the right protocols to correct those mechanisms so we can start cleaning up these reasons, if you will, okay? So there's a term now that's used in this chronic pain, chronic fatigue world because the statistics are so high, and it's called vertically ill, okay? We're not sick enough to be horizontal, although some of you are, trust me, I know that. We're not sick enough to be laying down horizontal 24/7, like as if you have a major flu, for example. Excuse me. But we're sick enough with 20, 30 different symptoms that we're walking around vertical, but we're sick as could be. And the one thing I want to say about that is, because you've been blown off, I know, by a bunch of healthcare providers probably, that there is common and there's normal. And this is really, really key to understand. Common means that most people have it, okay? Normal says, should you have it, okay? So I go to the doctor with headaches and upset stomach and irritable bowel and diarrhea and, fatigue and all these symptoms. And the doctor says, well, you're getting older, it's just normal, okay? Disregard that. As soon as that doctor says that, move on to another doctor, okay? Because here's the reality. Those symptoms may be very, very common, but they are in no way normal. The human body has been studied, endlessly, and they've proven that if the right things are done day in and day out, and your body's functioning at a very high level, you should be getting up day in and day out with tons of energy, okay, with very little, if any, symptoms at all, and you should have vigor and vitality and high energy and tackling the world kind of concept. And that should last throughout your lifetime. Right? Yes, as time goes on, we lose certain hormones and things like that slow us down a little bit. But in today's world, according to the World Health Organization, we actually fall off a cliff. We go from, healthy to extreme poor health. And the rough estimate on age is around 48. So in America, we have 48 healthy years, and the rest of the time, which now we're probably at tops in longevity, upper 70s by most publications as how long we're living. But if 48 to upper 70s is ill health, most of us are walking around vertically ill. And we accept that as normal. And I'm here to tell you that that is just not the case. Okay? And research backs that up. But there has to be an understanding as to, well, why are we so chronically ill? And I'm going to get to that. And why aren't we working on it or treating it properly? And those are two things that we'll talk about. The bottom line is, this video, I want you to understand my approach, my background, what we're trying to accomplish, and how we're different than most of the other healthcare providers that you have seen. But beyond that, I want you to learn how to be your best doctor. I want you to learn how to I want to teach you how to fish. Because that's most important to me, is that I'm putting out good information that's going to help you beyond us working together. Or even if we work together, you know, the 10, 15, 20 years after we work together, I want to still teach you how to stay well on your own. Okay, a lot of models, all right, are working on this back-end marketing technique, right? And not to get too, political here, but with the conventional world, right, the system is all about putting you on a medication, not healing the problem, so you always need the medication, okay? That makes people billions and billions and billions of dollars, all right? The faster you understand that and the faster you realize that's reality and that's what that system promotes, you'll do much better, okay? You can deny that. I say you can stick your head in the sand and pretend like it doesn't exist, but it absolutely does, okay? And even in the alternative world, even the alternative world, if you're going to somebody and they're just giving you supplements and doing the Band-Aid approach, you're gonna need those forever. So there's a system in place for back-end marketing. At the end of our process, I don't want you on your medications, that's the best case scenario, and very few, if any, supplements. There's no back end to this. We want to fix mechanisms, heal the body, tell you how to maintain it, and move on. Whole different approach here, okay? So that's part of what we're trying to accomplish. Okay, so with this overall process of functional medicine, I want to give you an example of how this might work, okay? But first, before we do that, I'm going to give you a method to the madness. So when somebody comes in to see us, the first thing I have them do prior to coming to see us is fill out a bunch of paperwork. And there are, over the years, there's about 10 different areas of the body that have been very, very common with all of our patients, right? So I call them the Big 10. The Big 10 is, and these are, by the way, some of the most misdiagnosed and mistreated conditions that we see in practice every day. Digestive health, okay? It's critical to your overall health in so many different ways, and most of the patients with chronic fatigue, chronic pain type of issues have very, very poor digestive systems, and there's nothing really done about it, right? In the conventional world especially. Number two, in no particular order, most of my chronic pain, chronic fatigue patients have autoimmunity. Their immune system has cranked up, starts attacking their own tissue, they get chronic inflammation and chronic fatigue just like you have the flu. Right? Not that you have the flu, but it's the same mechanism going on. We have poor liver detoxification. We can have blood glucose imbalances, whether it's too high, we get fatigue after we eat, we start to get craving of sweets, maybe increased urination, we're gaining weight, etc. Or we get too low blood glucose, which is in between meals, if I get jittery, shaky, moody, irritable, that is hypoglycemic type of symptoms, okay? That blood glucose imbalance is a major detriment to your physiology and your function. We could have adrenal malfunction, where adrenals are your stress glands, that if you're overly stressed via emotional stress, family, home, finances, things like that, but also if you're autoimmune and your blood glucose is shifting and you're getting biological stressors in your body, your cortisol is going to respond to that. And eventually, if that's chronic enough or over a long period of time, your cortisol will start to become deficient. And you'll get inability to fall asleep or stay asleep. You'll get afternoon fatigue, dizziness when standing, low blood glucose, low blood pressure, a lot of you. You'll get weak nails, you'll have heavy perspiration, you'll get weight gain with stress, wake up very, very tired in the morning, etc. Okay, so the adrenals are almost always affected in our world because most people come to us chronically ill. They've been going through these stressors for a long, long time, and the adrenals just take a beating as a result. The thyroid, one of the most misdiagnosed, mistreated conditions on the planet today. So we have thyroid malfunction. We could have hormonal imbalances. A lot of my patients have anemia, which is low oxygen attached to red blood cells, which means your body's not getting the oxygen it needs. So fatigue is a big factor there, or a big symptom there. We could have brain fog and ill brain health, and that's basically secondary related to all the things that are going on, malfunctions in your body. Hormonal imbalances, if I didn't mention that one, etc. The point that I'm trying to make is, over the years, these are the 10 areas, I call them the Big 10, that have been consistently bad with my patients. So again, over the years and doing this such a long time, you start to see patterns. And so what we've done with our paperwork is we will ask specific questions about each of those areas. The concept is we're trying to get the reasons or the causes of your problems, symptoms, from the Pacific Ocean down to a pool of water this big, okay? So it narrows the field. And the first thing I do when I open the file, prior to scheduling a patient to come in, I look to see if you have a lot of the symptoms that I'm asking for related to those 10 areas. If you do, the shoe fits, you're a good candidate because you're asking or answering questions that I've asked that I'm very, very good and well trained at healing. If somebody came in with, as an example, we ask 0 for every question, 1, 2, and 3. 0 is that it's never a symptom, 3 is that it's always a symptom, and of course 1 and 2 is somewhat in between. So if I see a patient in their digestive system questions, stomach, large intestine, small intestine, with 2s and 3s as an example, I know right away there's digestive history, okay? There's a digestive system dysfunction. Same thing with liver, same thing with blood glucose, etc. It narrows the focus. So when that person comes in, we see 2s and 3s everywhere, we know you're in the right place. I have Joni schedule you, we come in, we sit down, we do a consult, I ask a million questions on these, I allow you to give me a thorough history, try to figure out how many doctors you've been to, what the approach was, what you've done before, etc. At the end of that first meeting, my objective is, what other data do we need? What do we need to do to figure out, what else is going on that's probably been missed, okay? One of the big problems that we'll see with this type of care is that labs are inadequate, number one. And then the second part of that is if we're not doing the right labs, we're going and not finding the problem, we're going to dismiss that there's even a problem, okay? Thyroid is like that, autoimmune is like that, digestive history is like that. All these big 10 are the most misdiagnosed, mistreated things that I see on the planet every single day. Okay? And that's really, really important to understand. So let me give you an example briefly, and I'll use the adrenals as an example. So your adrenal glands, I'll give you a quick example, okay? The adrenal glands are your stress glands, okay? And the stress glands are reacting just like it says. They're your sympathetic response, your fight or flight response. And they produce something called cortisol. So I'm going to use a quick example. If a soldier is at war and the soldier goes to war and for the first month or two he or she has bullets flying everywhere, their cortisol is going to be produced at a very, very high level. Okay? And if it's produced at a super high level, they're going to have some changes in their body. They're going to be anxious and irritable and they're just going to be on high alert constantly. Well, if they're in that environment for a year, 2 years, 3 years, it now becomes chronic. And if it's now chronic, cortisol, the human body can't keep up with cortisol that long. And so it starts to dip. And when you start to get low cortisol, you're going to begin to get symptoms like fatigue and afternoon fatigue, and you're not going to be able to sleep right. You're going to have, waking up is going to be very, very difficult. To keep it simple, there's not enough gas in the gas tank, okay? Most of my patients have this adrenal malfunction, all right, because they've been chronic for so long. So whether you're a soldier at war or somebody suffering with chronic inflammation and chronic pain and chronic fatigue and poor blood glucose stability and so forth, you're going to get to the same place of this adrenal fatigue. With the soldier, it might be very quick. With you, it may have taken 5 years, 10 years, okay, as an example. The point that I want to make, though, is once we understand that the adrenals are affected, we then have to know what affected them. So this is kind of this functional medicine approach, and I'm using this example. So we know that stress is a big factor. We know inflammation is a factor. We know pain, it stresses the adrenals. We know things like what they call dysglycemia, your blood glucose instability. So I'll put dysglycemia here, right? We know that these things affect the adrenal glands. Now, here's the deal. I could give you some herbs and botanicals to help support your adrenals. They work extremely well to get the symptoms better, okay? and you're going, wow, I feel better on these supplements because they're addressing your adrenals. However, if I never address the causes here, we don't work on your stress. We don't get the inflammation right. We don't get your pain lower. We don't fix your blood glucose level. Your adrenals will always be stressed, okay? And you'll never be able to stop taking those supplements, okay? So the point with this functional medicine mechanistic approach, we know how to deal with this. We know how to get inflammation better. I know how to get the pain reduced. I know how to get dysglycemia or blood glucose healed and reversed and stable again, okay? Because that's what we've been taught to do, okay? So if I get all this regulated, now your adrenals can actually heal. We pull you off the supplements or the herbs, botanicals that we gave you to support them, and now they function at a high level. How do we know this though? Well, we do testing, okay? If I test your adrenals and they're low, which most of my patients are, we do this whole process, and then eventually we pull you off and your adrenals, you don't have any symptoms still. We retest and they're back up to normal levels. We've healed your adrenals. You see? Now, I just used that as an example to teach you that each of the 10 things that we work on is exactly like that, okay? If we're going to clean up your digestive system, we have to know what's going on with it, and then we have to work through a plan to clean it up. It's called the 5 R's program, right? And each of those R's has a different, protocol that's going to allow the gut to heal, okay? And then retesting can be done to make sure it's healed. And then we go through the liver the same way, or the blood glucose, or the thyroid, or etc., the exact same way that this approach is done. Now, again, I know this is a lot, but think about this mentality. You go to an alternative healthcare provider, and I'll tell you how this is missed in the medical world too, because this is often done. Alternative healthcare world, they give you, oh, your adrenals are not functioning well. They give you support, but they never look here, okay? And if they never look here, you're always going to need the adrenal support. And if the symptoms, the causes are severe, then those herbs and botanicals really aren't going to do much for you, okay? The key to all of this is understand what causes the problem and then get rid of the causes so the problem no longer exists. That's the point that I want to make, okay? And especially, I'll give you an example here, adrenals. In the conventional model, the adrenals are tested via blood. The blood work is not sensitive enough to pick up functional deviations in your cortisol, okay? What I mean by that is it will pick up pathological deviations, Cushing's disease, Addison's disease, if I have a tumor on my adrenal glands, etc. And so if those tests are done, a blood work is done on somebody with the symptoms that I described, can't sleep, waking up tired, dizzy, withstanding, they get low blood sugar, low blood pressure, they get, weak nails and afternoon fatigue, and they feel drained, they can't handle stress, all those different things. You go to your medical doctor, he does a cortisol test that's very insensitive, and he says your cortisol is fine, yet you have those 10 different symptoms, okay? The problem is it's not tested right. Saliva is known in the literature to be the most sensitive cortisol test out there. So if you did a cortisol test via saliva, we do it with almost every single patient, and it comes up off in almost every single patient because they have all this stuff. They come to us chronically ill, so we know the adrenals are going to be affected, all right? So then we identify the problem. So think of the conventional world. If they do the test and it's negative every single time they do it, they don't even recognize that there's an adrenal malfunction, or they don't even recognize adrenal fatigue as an actual diagnosis because they never see it. That doesn't mean you don't have it though. And that's the point that I want to make. That's what's happening with these 10 things that I described. Digestive health, liver function, blood glucose, adrenals, thyroid, hormone imbalance. If they don't test it properly or they don't believe it's there, then they're never going to be able to address it and fix it, right? You can't find or you can't fix what you don't find, okay? So I know that's a lot, but that's how to heal, right? It's the mentality, and we use that through these 10 different areas of the body that are going to allow us to understand why you're not functioning well. Use this approach to healing and you're going to get better. It's almost foolproof. It's just rarely ever done. It's all Band-Aids. Everything's Band-Aids today. Everybody's looking for the short-term, quick fix, you know, and this process is not that way. It's going to be a marathon. And that's the other point that I try to make with this video to teach you. This is a marathon approach. This is not a short-term approach, okay? It's going to take us 6, 9 months, 12 months for some of you to heal your body. Don't shoot the messenger. That's not my fault. To do it right, it's going to take time to understand, all right, you have adrenal malfunction, you have these 4 issues. We have to heal those 4 issues before the adrenals get better, okay? But if we do that with every system of the body that we discussed on the paperwork, again, digestive health, liver, thyroid, hormones, etc., you will start to function better. You will start to feel better, okay? And that's going to allow your body at the cellular level to start to heal. And when you're healing, right, you set the environment up right, conducive to healing, your body will start to heal. And it may need years to heal. We're just pretty much setting the stage for the healing to take place. And as well, redoing testing, doing the treat, test, test, treat, retest mentality to make sure your numbers are good, your symptoms are good, and we're good. We've done our job. Okay? So that concept of test, treat, retest is how we're held accountable to make sure that your problems have gotten better, because the labs that we're doing, the right labs, are adequate enough to show that you had a problem, we worked on it, and then there's no longer a problem. Okay? Gotcha, I know that's a lot, but that's the difference in this model of functional medicine versus other alternative healthcare approaches and certainly the conventional model. And it's exactly why you have not gotten well. I know you guys have been to dozens of doctors, spent a ton of money. The point that I really want you to understand that you have to decide is that, did they do this approach? If they've done this approach, then I might not be able to help you. But I can tell you 99.99% of the patients that have seen me, this approach has not been done. This is a rarity, gang. And I don't mean to, I'm not patting myself on the back. I'm telling you, I've explored the truth for 20 years. I've tried to figure out what's going on. And early in my career, with the chiropractic sports medicine approach, my background, biology, sports medicine, etc., and the chiropractic end of it, we were working on patients, and some would get better and some wouldn't. And they had similar x-rays, similar findings, similar MRIs, etc., and some would get better and some wouldn't. And what we've learned with that is the ones that didn't get better because they had a lot of issues going on, and we had to get those issues better so their body could heal properly. There's a book that I'm writing, it's called Healing Beyond Therapy, and it's all related to getting the internal environment better and healed so that the body is able to heal. The tissues are able to heal. The inflammation in the knees and the joints is better. So healing is going to be better as a result. Okay? It's just the right way to do it. You don't have to agree with that, but I'm telling you, for 20 years I've explored this and studied it. This is the right way to get somebody better. But it's not the easiest way. It's the tough road. I'm going to tell you that right now. So the way we do things as far as in our clinic is we have, when you come back for the second visit, we lay out a plan, step by step. I tell you what we're going to do, how we're going to do it, the logic behind it, and then how long we're, like for example, if we're going to use a supplement to heal a mechanism, why are we using it, what are we doing, and how long it's going to take. And then I have to monitor you constantly because every individual is different. It's not a cookie cutter approach. So we tend to talk every 5 to 7 days, over the course of 6, 9, or 12 months. And you need that constant, I need that constant feedback, and we need to be communicating that regularly so I can help you navigate along. Ultimately, I'm the navigation system, you're driving the bus, okay? I'm just guiding you through the process. You're hiring me to guide you through the process. Okay, and that's really, really important to understand that the process is very complex. It's not this easy, oh, just tell me what to do, I'll do it. There's a lot more to it than that. And so we may have to consult 30, 50, 90 times in order to get you better. And unfortunately, insurance may or may not, reimburse for that. Some do, some don't, a lot don't. And so there is an out-of-pocket expense to this. But I always say, don't shoot the messenger. My objective is to give you a plan that's going to get you better, okay? And then we're going to give you a dollars and cents amount as to what that's going to cost. The point that I'll make is that those dollars and cents are designed to heal you and get you better over a long period of time. However, insurance may not reimburse, so we have you commit to the entire process because that's what's going to allow you to heal. Quick example. You say, hey, I just want to go month to month with this. So we go a month and you're not that much better. And you say, well, I'm not getting better, so I'm going to quit. But yet, we've identified 10 different problems in your history, and you've only given us the chance to get maybe a half of one done. And if that's the case, if that's your mentality, that you just want to kind of see how it goes, it's not going to work. We don't do it that way. And I don't do it that way because the only thing I care about is results. If you commit to the process, you understand the process, you will get better. There's no question about that. It's just a matter of understanding the commitment it takes to get better. So we're going to have you commit to the process up front. It has nothing to do with dollars and cents. It has to do with getting you results. Having your family and significant other involved in the process, as well as committing to the process up front, are the two things that I've studied over the years that gives us the best chance for results. Okay? Some people don't agree with that mentality, and I understand it. But I'm telling you, from a trust standpoint, those are two things that are going to help you get better without dropping out early and saying this thing didn't work. That hurts our reputation, and you don't get well, and we won't do it. Okay? So I look forward to seeing you on your next visit, and we will go through things in their entirety. Okay? Look forward to helping you. Take care.